We are here to implore the government of Quebec and our own CIUS West Central Montreal to recognize that the virus at Maimonides is once again out of control, and to take immediate action to curb the spread and prevent more suffering and yet another devastating loss of lives. We are asking that there be a mandate for weekly testing, mandatory testing of all employees, caregivers, visitors. Testing is currently on a voluntary basis with the exception of when a case is found on a wing or they have identified somebody as COVID positive. Even the specialized COVID agents who have been put in place are not required to be tested, and they do have direct contact with the residents. This is unacceptable. Mandatory testing is essential. The facility has 351 residents. It is the second largest in Quebec, and within a 2-week period, we have had 52 residents positive COVID, 4 deaths, 22 staff, and 11 direct caregivers. This, Monsieur Legault, Monsieur Dubé, Monsieur Arruda, Dr. Rosenberg, is not under control. 2, we acquire rapid 15-minute tests now. CIUS West Central stated in a communiqué to the media on Tuesday that they are going to propose a pilot project for rapid testing to the Ministry of Health and Social Services. Bar all staff from working on multiple floors and or wings, and immediately engage a SWAT team or the Red Cross. Our CIUS says nursing staff are not working between floors, wings, and hot and cold zones, but this is not true. Nurses and PABs have repeatedly said they work on multiple zones and floors, including between hot and warm and cold. RNs have said they are working on multiple floors due to the shortage. PABs have told residents and family members that they were not transferred down from the cohort unit that they were transferred from the cohort COVID unit to work on another floor. Dr. Rosenberg, are you saying that they are lying? Why would they lie? They are working unbelievably hard, trying to save our loved ones, putting themselves and their families at risk. The fact is that there is a shortage of staff, and this is forcing staff to work in multiple wings and floors to provide essential care. Transparency on the part of the administration and the CIUS is the first step in finding a solution.
Well, right now, over the past 2 weeks, we've had over 50 cases, residents testing positive, 22 staff, 7 caregivers, and I just heard about 5 minutes ago that since yesterday's official staff statistics, we have another 5 residents that tested positive and another 2 deaths, bringing the death toll now to 6. This has all happened in 2 weeks. At this rate, if it's not brought under control at this rate, I can't imagine the toll that it'll take if it's not brought under control now.